Hi everyone, my name is Dr. Neville Wellington, and as we've spoken before, I'm interviewing one of my patients who has really been very successful in changing her life and reversing her diabetes. And her name is Mapaseka. I just want to say thank you so much for coming here this afternoon. It's really been a privilege to know you and to see your journey.
My journey.
Yeah, and so we're just going to spend some time just going through that. As I've known you, I think almost 3 years now.
3 years, yes.
And it's been quite a journey over the time. So maybe just tell us, firstly, when were you diagnosed with diabetes?
2017, on the 22nd of January. So she said to me, you know, Mama, that diabetic dangerous when you have diabetic, when you sugar diabetic. So she said to me, you must stay away from that, drinks, sweets, then you must look what you eat because it's dangerous. Okay. So that time I was, for me, it's like, then she said to me, you know, it's killing the sugar diabetic.
Wow.
You can die if you keep.
And did she prescribe anything else other than saying no cool drinks, no sweets, no thing? What else did she tell you should eat as a diabetes patient?
No. She
didn't
say that. She just said, you mustn't eat that sweet stuff. Yeah. You know, when doctor said to you, when you keep eating this stuff, you're gonna die. So the first thing it was in my mind, my children.
Yeah.
But although I want to quit, it's not easy.
Yeah.
When you eat sweets, drinks, you eat jam, it's not easy. Then I came to Dr. Wellington.
Yeah.
Then it's where it was starting, because I meet with you, doctor, then you tell me that Mapaseka, the way you can make the things different, then you must eat healthy. It's only about eating plan. I'm like, for eating plan. Then she said, she gave me the sheets. She said, it's where you're gonna see when you eat something, then take this at your check and prick yourself, and you will see what is work for you, what is not working for you, then you will see. Then I'm like, wow. Then she tell me the bread, rice, spaghetti, and you know this spaghetti and the bread that the body needs. I need that bread, I need spaghetti, I need this, but wow, it make me worse. I was like, dear my God, because I'm like, what I'm going to eat, what I'm going to eat, what I'm going to survive, because I need food. And that time I was like hungry, I need this food. Up until I decide myself, let me change my plan. It was not easy for me to change.
And how long do you think it took you to actually manage to change the diet? And because when we first saw you, you'd already lost a bit of weight.
Yeah.
And how much did you weigh when you were first diagnosed with diabetes? You said what?
129. Okay. So I'm struggling to lose weight because I was cheating. Go to gym and eat this. Yeah. Then the weight was not going down, and the sugar, it's still, I can feel. The worst part for me that to this diabetic, I was feeling mental in my mouth. Can't get a taste, nothing. Okay. It's only a metal in my mouth. Taste, yeah. So I speak to Dr. Wellington. I told I've got this metal in my mouth. I don't know, but as I keep to my diet, stick in my diet, it was not easy, but I keep stick in my diet. Just if I eat oats, it was worst thing for me. Okay. When I eat my breakfast, because I like my oats, eat oats, doesn't work. When I break, my sugar is up. So I have to quit sugar permanently. No sugar, no oats, no nothing.
And so how long did it take you to get off that?
I have to make, I don't know. It was like,
I think
I was putting in my mind, especially sugar. Yeah. To drink coffee without sugar, for me, it was, because I used to drink my sugar. and I used to drink my drink. I used to eat my sweets. But okay, it's fine for sweets. I quit sweets, but now the problem, it was sugar in my coffee. So without drinking coffee without sugar, for me it was, but because I was thinking of my health and Dr. Wellington, what she said to me, then I have to. I think I was getting to that point, like what I want. I've got children, I've got family who need me. So I know sugar, it's killing. It's a slow killer. I have to. I have to. Then it's where I start to quit sugar.
Because what was amazing is, as we followed you, I think it took about 6 months before you really kind of were able to...
6 months before I
could come off the sweet stuff.
And the sweet stuff, it was not taking so long, but I end up like not taking sweet stuff at all. And look, then I go to my greens, then I eat veggies, a lot of veggies and green stuff. Drink coffee without sugar. Another thing was make my sugar up. I noticed when I drink that shit Dr. Wellington gave it to me was helping a lot, because when I eat coffee, when I drink coffee without sugar but milk, my sugar up. So it means the milk with me. That is why I said, I don't know, maybe my colleague always said to me, what the things work for me doesn't work for you. So we must, that is why that shit was helping me a lot. Every time when I eat something, I prick and check my sugar after 1.5 hours. Then I check and prick, check. Then I see, okay, this doesn't work for me and this is good for me. And this especially fruit was make me, when I eat fruit, I was worse because I was trying to, it's like snack. So after I eat my lunch, then there by 2 o'clock, then I'm a snack with fruit. It doesn't work for me, the fruit, up until I realize, okay, let me buy some greens like cucumber. Then I snack with my cucumber, drink a lot of water, a lot of water. I think the gym and check what I'm eating, a lot of water, it was helping me a lot up until I lost. Now I'm weighing 96.
Sure. So I mean, you started at 129. I think you lost quite a bit of weight just before I saw you. You were down when I saw you about 117, and then it took a while. It was really because your weight sort of stayed stable. You weren't quite getting the diet right. In fact, your HbA1c, I think in November of 2017 had gone up to 6.7, and so we were still trying to clear things up, and then really from the next year it started coming down, and by February of 2018 it was 5.9%. Your weight was still not coming down yet, and then suddenly you changed something, and as you say, you probably at that stage started cutting out fruit and more oats and sugars. And by the end of 2018, you'd actually come down to 108. I think, in fact, by the end of 2018, you were down to 108. And last year in May, you were 96. 96. And you now, what would you say, 96?
95. 96,
right? So in total, you've lost from 128, you lost almost 30 kilograms, 32 kilograms, 33 kilograms. I mean, that's phenomenal. Plus, your blood pressure has been normal.
And now I'm not taking
any blood pressure tablets. No, you were able to come off them. In fact, we stopped them.
Diabetic, I'm not taking nothing. And when I think it's 2 years now, I'm not taking
any medication. I think from the beginning of sort of end of 2018. That's right. We stopped the medication end of 2018. So it's a year and a half at least. Which has been amazing, and your blood pressure at the last time was 108/72. It was perfect. So, have you found it difficult to maintain this? Has it been a difficult thing to keep doing? I mean, how many times a day do you eat now?
I eat once a day now. I just grab a cup of coffee for breakfast because I'm too busy at work. Just grab a cup of coffee up until 10 o'clock. Then 10 o'clock I eat my breakfast. So, yes.
And what's your breakfast normally?
I like my egg
Okay.
So boiling egg,
Yes.
my breakfast.
Okay.
And cucumber, slice of cucumber, and tomato, and slice of few cheese, like 2 slices of cheese, just for the taste. Then I eat. Then coffee, then water, up until I go to the gym, 1 o'clock. So when I came back, cucumber. I cut my cucumber and tomato and sit down and eat. Then I'm going to eat supper.
And what is your supper consist of nowadays?
Okay, supper, if they cook chicken, I grab a piece of chicken. I'm not eating rice. Lot of veggies, like spinach, tomato, cucumber. I like my cucumber. Cucumber, always cucumber. When I lettuce, then I eat it. It's my supper.
So it's actually about 2 meals a day.
Yeah, 2 meals a day, because it's the breakfast and the supper. Then I snack with the cucumber. Then I push with water the whole day, because I'm gymming. Yeah, so I push with water. Yeah.
And how do you feel now compared to when you were?
Oh, I'm feeling I'm good.
Do you have energy? Good.
I have energy. Yeah, I have energy.
And do you still feel hungry like you used to?
No.
Okay.
No.
The hunger symptoms are gone. You can.
Yeah.
You eat because.
Yeah. For me, it's like hungry. I always telling myself they're hungry. It's here. I don't think I'm hungry.
Yeah,
when you think I'm hungry, then it's coming. I always think also, okay, if I tell myself I'm hungry, then but when I grab my cup of coffee, then I'm good. I'm fine.
Okay, sure. And how's it affected your family? I mean, you've obviously changed. Has your family changed diet a bit with this?
Yes, they were, because first, to eat veg in my house, it was not. We were busy like rice and that stuff and that, you see. So, since I have diabetic, then we decide, okay, we must eat like same, like even though they eat their rice, so that I'm off to rice, then I'm gonna eat these veggies. They're gonna continue with the rice, but the veggies, yeah.
Okay.
They support me a lot, my husband and my children,
Which is important. I mean, having a supportive environment makes a big difference.
Makes a very big difference, I think, to them.
And how do you feel? I mean, in different cultures, they value different things. I know in your culture, maybe pap is a big thing. And how did you? Is that something that's?
Let me tell you something about pap. I like pap.
Okay.
Oh, I like meal pap.
Yeah.
When I'm there in Eastern Cape, they always cook pap.
Yeah.
So pap is my favorite. I always said, you can dish for me pap, but 1 spoon of pap. Okay. 1 spoon, then it's fine. Don't dish a lot. And if they eat pap, like today they eat pap, so I can go with them with pap and my chicken. Then tomorrow they're gonna eat again pap. I'm not there. If I eat once, I'm not continuing. It's like when we eat pap, or when they eat something today, tomorrow I'm not gonna eat that stuff. I must change and eat, although they're gonna continue to eat that. So if I eat today pap, I'm gonna eat again 2 weeks back or 3 weeks back. Just once.
Just once. And did you ever test your sugar after eating pap?
Yeah.
Was that part of your diet that was spiking your sugars?
Pap, yeah. So that, pap, I know.
So you could see that pap was actually a problem.
Was a problem. A pap, meal.
Yeah.
Yeah, it's meal rice. That starch. It was a big problem. Starch, a special starch. You can sit now, then prick your sugar. It's 5. But once you eat starch, prick again, you will see it's up because of starch.
Yeah. And I mean, do other people do they think gee, this is strange that you're eating so differently?
Yeah. People, they like, are you gonna make yourself full with this? And I say, yes, I'm used to. I'm used to 2 years. It's 3 years. I think it's 3 years now. I'm eating that.
Yeah.
I'm used to, so.
It's an improvement, sure.
Yeah. You can eat your nice food in front of me. I don't even have that, like, wish I can
desire
get a piece.
Yeah.
It's fine. I'm fine with my greens. I'm fine. I eat meat, my piece of meat and my greens, but the things I don't touch, it's sugar.
Yes.
Sugar. That is why my sugar level are going down.
Yeah.
Yeah.
And when we've downloaded your glucometer, I mean, and it was showing quite high levels there, above 10, 11. Yes. And then as you started to change your diet, it slowly came down. It was still some spikes. And then, but we actually, unfortunately, the sheet, there's a year missing here because there wasn't much change, but you could see it slowly came down, and now it's really come down. I mean, you're constantly in the normal levels now. And that has made a major difference. And we haven't downloaded to November, but in November when we did last see your HbA1c had come down to 5%, and it's normal. I mean, it is completely normal. It's what my level is. Yes. And so you've done amazingly well. And as you said, this is a cure. This is a cure. Yes. And you've done it, which is amazing.
I've done it.
And I think you've done it even though in your environment there's a lot of sugar. You've maintained your sugar levels amazingly well over the last 2-3 years.
I can see it was up, yes.
A little bit, yes, just over there, those spikes. But and do you find now you don't need to test so much?
No.
Because you know now what you're eating
and you know now, because I don't feel nothing. I'm back to mapaseka. So when I eat something wrong, it tells me quick.
Oh, you feel
the body.
Yeah.
Yeah. Okay. Quick. Immediately I finish to eat. Then I'm like, give me that acute check. There's something wrong. Then when I prick, it's 6. You know, when it's 6, it makes me worry.
Okay.
I don't want my sugar level go to 6. I always tell my children, I don't want my sugar levels go to 6. That 4-5 for me, it's fine.
4 or 5 is
4-5, it's fine. Not go to 6-7. It stressed me a lot.
Okay.
It stressed me a lot.
And then do you find it goes down quite quickly afterwards if you go and do a bit of exercise? Or
it's quick. Like Monday or Sunday, it was 3.9. Even if it go down, it tells me in my body
quick. Too low.
Like I'm like a little bit dizzy. I'm a little bit dizzy when it's 3. Once it starts to 3.9, then I'm feeling different. Then
it goes that low even if you're not on medication. Yeah,
it goes. Like if I'm not eating, like there's days when I'm jumping in the bed, so I do everything without. Then I think after 12 o'clock I'm not eating. It tells me in my body you didn't eat, just grab something. So once I immediately grab something, I eat. Then it's quick up. Yeah.
What has been the most difficult part of following a low carb diet? Have you found?
To stay and maintain the diet. It was for me. It was good to stay and maintain the diet.
It's not been difficult.
Yeah, it was difficult, but to stay there, it was for me.
Okay. Have you noticed any other benefits then? I mean, I don't know. Some people say the headaches go away, the stomach pains go away, the body aches and pains go away. The energy levels improve.
My body pains go away.
Okay.
My body, I was have a lot of pains in my body.
And that's improved.
Yeah. So I don't have body pains. Yeah.
Amazing.
My mom, she's still struggling. When she prick with that, I always said, prick yourself. Like 2 weeks back, I told my husband, my mom was like 31. Yeah.
My goodness.
31. I told my mom, you're in danger. You can't go 31. She's using the insulate. But
is she not changing what she's eating?
You can. If you want to change, you tell people. Then they want to change. It's you. If you want to change, you just go straight and change. If you don't want, you keep saying, tell the people. But I'm trying. I don't know for how many times to speak with my mom. And she don't even believe if I'm not taking the medication. She's scared. She said to me, how can you stay without medication? Always she asked me, Mapaseka, are you all right? Why don't you drink your medication? I said, no, I'm off to medication. because of I know I'm eating healthy, I'm gymming, I'm exercising, I know. So you don't want to listen. I don't know.
You know, your mom.
My mom
wants to continue to eat the sugar, and it's not helping. Yeah. And yet you know that she could have cured herself.
Complaining. She's got pains. She's got headaches. She's got this, and she's up and down to doctor. Up and down to doctor. I said, there is a cure. Just stop to eat this stuff. Just go exercise. Even if you walk, you must know when you wake up or after lunch or when go take a walk, you will see. Drink a lot of water. Stop with the sweet stuff. Yes. Eat healthy. You will see.
It will make a difference.
It will make a big difference.
Do you think that your mother is actually addicted to sugar?
Yeah, she is. She is. She eats sweets like I don't know. The fruit.
So there is an addiction. I mean, people say there isn't, but you and I know it's difficult coming off it. You took a while to cut it.
Very difficult.
But once you got it.
Once you got it, then everything is running smooth. It's smooth.
So what would you tell other people? I mean, you told your mom this. Would you tell other people that you come into contact with diabetes? What do you normally say to them?
Yes, they're at work. There's a lot of people who's diabetic. A lot of people. Other colleagues, they always speak with them. Go to Mapaseka. Then sit with Mapaseka and speak with Mapaseka. She will tell you, Mapaseka, she's coming so far with diabetics. There. So they end up coming to me, lot of colleagues. I speak with my colleagues, and I told my colleagues where I'm coming from up until now. Other colleagues, they don't even recognize me when they saw me, because at that time I was diagnosed with that. First time I was hurt, I was fat like I don't know. So most of the people, they just pass to me, they don't even recognize, because I lost a lot. I lost a lot, and I can feel it in my body. So I always sit down with them and speak with them. Like the cure, there is a cure when you have diabetic and when you have high blood. You know, sometimes people, they can't believe you. It's like you're playing with them. I know I'm coming from there. I'm coming from there.
And what is the main thing you tell them then when they come to you? What do you say?
I just tell them, I know guys, you can't believe if this diabetics have a cure, but believe me guys, there is a cure. Just stay out from the sugar totally. That sugar, it's a poison. So stay out from the sugar, just focus, eat healthy, trying to exercise. I know it's not easy to exercise as a woman,
especially if you're sick.
Especially when you're sick. We lost the hope. When you're sick, then you and you know us, we're going to work. After work, there's nothing you think, you must run to the house, you just do the chores of the house. There's no time for gym. There's no time for gymming for us. So you can make a plan just to look after, just for your children, after your health, for your family. Just you make a plan, you just go to the gym, you just eat healthy. You know, my trainer always said to me, it's 20% for gym, it's 80% for food. What you eat.
That's very clear.
It's 80%. So even if you don't go to gym, but check what you eat. I know it's not easy to them when I speak. They always ask me, what are you eating, Mapaseka? Other one, you can see in my phone. I send them the pic. This, then they're like, are you eating this, Mapaseka? I said, yes, I'm eating this. I know it's not easy to go and eat this. But once you start to eat and tell your mind, now I'm going to eat this, don't stress about other things. I think just look after your health, eat this stuff, then you will see.
I mean, you mentioned people don't recognize you anymore. You know, you've lost over 30 kilos, you've reversed your diabetes, things are just so much better for you. And I mean, people who you haven't seen for a few years, I mean, has that happened? What happens when they come up to you and they say...
They were shocked. They can't even recognize me. When they see me, like up until I said, hi, how are you? Then they look at me, oh, Mapaseka, is it you? I said, yes, it's me. What happened? I'm like...
Do people think that you're sick?
Yeah. Most of the people, they think I'm sick.
Yeah.
Most of the people, they think I'm sick. You say, are you gymming? It's like they go, I said, yes, I'm gymming. And, oh, you eat? Yes, I said, I eat healthy and I'm gymming. They said, wow, Mapaseka, you are amazing. Wow, from there to there. I said, yes, it is me. Today, I was cleaning my wallet. When I check my ID, the ID photo.
Yeah.
Dr. It's a pity I didn't carry my bag. Now you will see that I'm like this. I couldn't even believe, because I was going to the bank. The lady was serving me. She was looking. Every time I said to my husband, you know what? Every time when they take my ID photo, they were doubting. It's like, it's you, ma. It's you. I'm like, yes, it's me. Yes, it's me.
That's amazing. What does your husband say?
Yeah, my husband was like, no, now you must stop now. The time I start to losing the weight. In our culture as African, you are a woman because of your weight. Our culture. So then, Transkei, they can see you when you're happy in your marriage. They can see you with your body. Now you're happy in your marriage, happy marriage. And then, so when you start to losing the weight, they always think in your mind there's a problem happening to you. It's like you're not happy in your marriage, or problems in your marriage, something like that. But yeah, my husband said, oh, and why are you supposed to stop now? You're losing a lot. That time I was 48, so I go to 44. It's where everybody can see there's a difference now, because my clothes are getting bigger and bigger. I didn't go to mirror for so long, up until I'm wearing size 40. One day I go to mirror, I was like, I was totally changed. From 48 to 40, I was totally changed, and my clothes was big. I have to start new wardrobe. When he said to me, can I join you guys? I'm like, are you serious? He said, yes, Mapaseka, I'm serious, because I see you lost a weight and you look much younger. Now I'm like, oh, thank God. Now he can see, at least he's noticed something. Now he's not moaning. He noticed something right on this diet thing. Yeah. He said, can I join you guys? I said, I joking. He said, tomorrow morning, I'm going to join you guys. Tomorrow, following day, 5 o'clock, we were there in the common field. I said, what is the poison? That is why the people are getting fat and fat. It's the sweets.
And has he lost weight?
You can see my husband. He's like, he lost. Last month, I was complaining to her. I said, stop running now. Now it's my turn.
So
from there,
you brought him right down.
He's worse than me. He's worse than me. Now he's wearing size 30. 30.
Wow. Great. Thank you so much, Mapaseka. That's been great to kind of follow your story.
Okay.
And you've done really well. I mean, as I said, your last HbA1c, I think, was 5%. You're actually down at 5%.
Yes, I know. And I believe the other doctors, they can say to you, you're diabetic. And for cure, it's like you never get a cure for diabetic. And there is a cure to diabetic. There is a cure. I'm proud of myself. When I look in the mirror, I look at me. When I'm thinking where I'm coming from, I'm like, thanks God.
Yeah, absolutely.
Thanks God.
Yeah.
I'm a strong woman.